Hello, you're watching this video because you or a loved one is suffering from a very chronic health condition, fibromyalgia. These are symptoms like chronic pain, chronic fatigue, or brain fog. Well, we treat this both metabolically and neurologically, and I'm here to tell you that no stone is left unturned to determine the exact cause of your fibromyalgia. My name is Dr. Stephen Moleski. I'm a chiropractic physician, been in practice for over 30 years. I'm located in Tallahassee, Florida. How do we treat fibromyalgia? By using both metabolic and neurologic testing and all-natural treatment protocols. No drugs, no surgery. Each person is different and unique, and because of that, we need to go through a very thorough diagnostic workup to determine the exact cause of your fibromyalgia. We run through 10 lab panels. The first is a complete metabolic panel. The second, a lipid panel. The third, a thyroid panel. The fourth, a complete blood count with differential. We can assess all your organs, blood cells, and gut function with these tests. Now, I know what you're going to say. Doc, I had all those tests done, and they all came back normal. Well, these tests are very, very thorough, and when a blood test comes back, it comes back with an average range, and that's the average range of the average patient that had their blood tested. Well, the average patient isn't really very healthy. So what we want to see is a functional range, which is much tighter. We want to see where your values fit into a functional range, because if you're out in these outskirts, you could be getting false negatives. So it's very, very important that we run these tests and fit your values into that functional range to determine what's going on in your body. The fifth is sensitivity testing. We check for sensitivity to gluten, eggs, milk, soy, and yeast. If you're sensitive to any of these foods, it could be causing your problem or greatly aggravating it. Some symptoms of food sensitivity would be indigestion, bloating, constipation, loose bowels, chronic pain or fatigue. So we need to run this test to determine if you're suffering from any or all of these food sensitivities. The sixth is adrenal stress index test. This is a saliva test that further checks your adrenal glands. If your cortisol level is imbalanced, you're going to suffer from insomnia and blood sugar imbalances. We can treat the cortisol levels using all natural nutritional treatment protocols. The next test are the immune panels. Your problem may be caused by an autoimmune problem. As you know, this is a situation where your immune system actually attacks your own body. It can attack your nerve system, your organs, your joints, ligaments, connective tissue. Your immune system is divided into two sections. You have a Th1 and a Th2, and they should be balanced. If we run this test and we find that there's an imbalance, that's a sign that you have an autoimmune condition going on. We need to determine the exact cause of that. Now, you may be infected by parasites, yeast, protozoa, viruses, bacteria, or toxic heavy metals, just to name a few. So it's very, very important to run this test to determine if you have an autoimmune condition going on in your body. The next test is an H. pylori test. This is a breath test where we check for H. pylori bacteria infection in your system. It's a testing for your gut function. The next is an intestinal permeability test. This checks for leaky gut syndrome. Again, we're looking at gut function. Your gut function is very, very important in your immune system. The final test is for inflammation. We can check for inflammation in your system by testing C-reactive protein and homocysteine. We find that just about all of our fibromyalgia patients suffer from a chronic inflammatory process. That's the metabolic side. On the neurologic side, we do specific neurologic treatments based on results we get from specific functional neurological exams. Your nerve system should be balanced left to right, up and down, and if it's not, it's like having a short circuit in your car. Your car won't work right. Well, your body's not going to work right if there's a short circuit in your nerve system. Your brain has 4 quadrants to it. The cerebellum is the lower part of the brain, and it actually acts to filter pain impulses coming up to the upper brain. If that lower brain is not firing properly, the pain receptors are fired automatically up in the upper brain, and oftentimes a cause of fibromyalgia pain. To treat that, what we do is called brain-based therapies. Now, we may run a vibrator on the right side of your body to increase the frequency of firing of your right cerebellum, which would act to help it to dampen those pain impulses. We may use auditory, visual, and olfactory stimulation as well. We use cold laser therapy. Hot lasers cut tissue like in a surgery. Well, cold lasers actually stimulate cells to function normally again. They wake them up to function well. No side effects. A very, very nice therapy. Non-surgical spinal decompression. Sometimes the joints in your spine are compressed and pressing on the nerves. This is a medical device that actually helps to take the pressure off the nerve. It also gives a slow stretch to the muscle, which helps to balance the nerve impulses going up to the brain. So in summary, we evaluate you metabolically and neurologically and treat you by all natural methods. At this point, we need to ask you 3 questions. The first, how has this condition affected your job, your relationship, your finances, your life in general? The second, where do you picture yourself in a year or 3 years from now if you don't get this taken care of? And the third, what are you willing to do if we could help you with this? And by that, what I mean is, are you the type of patient that will take responsibility for yourself? Will you follow our protocols by changing lifestyle, maybe changing foods you eat, nutrients you take, exercise? If you're that type of patient, you should call us and set up a consultation and an evaluation of your individual condition. You can call us at 850-878-5636. Or if you need more details, you can leave your contact information at the bottom of the page here, and we will mail more information to you. Thank you.